To introduce the pneumothorax tray kit that we finally got. This is going to be accompanied with all our zephyr valve patients. It's a very straightforward pigtail insertion, 14mm French catheter, and I just want to demonstrate how it's done. Okay, first of all, I'm going to skip a lot of the routine stuff that we do for chest tubes, but basically you will clean the patient, prep the patient, place a drape over the patient's area. Now, focusing on the patient, there's two areas where you can go. You can then go in the safe zone here, which is between the il7cy dorsi and the pectoralis and the 4th, 5th intercostal rib. Or you can also go in the second intercostal space on the right, or depending on where the pneumo is, it might be the left side. But you could also do the second intercostal space. But I'll just do this side here since it's already set up first. So as you can see on the kit, it's very simple. It comes with the guide wire. It comes with a pigtail catheter. The only key thing about this pigtail catheter is that this is what we have to do. There's an obturator that we use. So just let me break it down. This is the obturator, this is a pigtail catheter, and this is the dilator. The guide wire and the needles for insertion and a scalpel. Just to kind of demonstrate this, the obturator should be in here to straighten out the pigtail, but if you notice, it doesn't go all the way in because it gets stuck at the end. So you have to add this stopcock here, screw that on, and then we insert the obturator through this piece, move forward, and it kind of locks into place. Not that well, but it does lock into place. So we leave it that way. So the next thing you know, you have draped and prepped the patient, and you get your needle. Remember, always go above the rib, second intercostal or the 4th intercostal space. You do the lidocaine, anesthetize everything, and then once you find your space, you feel for the air gush. That comes out, and right away you insert your guide wire. So this is Seldinger technique. You remove your needle and your guide wire is in place. Then you would take your scalpel. Don't be in the way of the camera. And you make your incision. That's just to get the dilator to dilate. Insert the dilator. And you do a twisting fashion. You want to make sure the guide wire moves in and out so it's not kinked. You could do that twice just to give a little bit more of a room. Make sure your guide wire flows freely. Pull it out. And then now the hard part where you have to feed this into this catheter. Okay, so we get the guide wire into the catheter. And you want to wait for the guide wire to come out, as you have here. And then you're going to go and advance the catheter. You want to go up to the second line. There's 3 lines here. Advance it to the second line. Then you remove the guide wire and the obturator. And then this is where you will connect your pleural vac system. But we'll leave it locked for now to the patient. And then the other piece that we have is we're going to have a stat lock with the patient. So instead of suturing, we're just going to stat lock it. So we would remove the drape. You would insert the stat lock. This. Pull each button, take a butterfly that you pull apart. And then you bend the catheter over to this orange spot and press it into the patient and clamp over. And that's how you would just clamp it and stat lock it.